One of the most important questions on the table today for any healthcare leader is how he or she will find the money and manpower to keep investing in future growth as the healthcare dollar continues to shrink and the demands associated with being a technologically advancing and safety critical industry keep coming. As the last of the financial, operational, and reputational protections that came with being a social sector industry fade away, today's healthcare leaders, like any other industry leader, have three places that they can spend their money, dedicate their manpower, and allocate their resources. They can focus on fixing the past, surviving the present, or growing the future. Unlike days gone by when it was pretty easy to spend on fixing the past and surviving the present while still having enough left over to grow the future, today's environment is one where every dollar or hour needlessly allocated to the past and present is a resource stolen from the column for future growth. While the industry has shockingly survived in a highly resource-intensive quality culture that promotes overinvestment in fixing the past and surviving the present for more than 2 decades, the fact that the average leader can now be allocating as much as 50 cents of every dollar his or her organization earns to these types of activities has created a host of financial, operational, and reputational problems. As the available healthcare dollar continues to shrink and turning to traditional funding sources to fill in the gap will be like looking for water in a dry well, leaders need to start moving as much as 35 cents of that 50 cents back into the column for future growth if their organizations are going to keep pace with the industry's technologically advancing environment. Doing so will be largely dependent on their ability to retool the work environment to get more things right the first time in sustainable ways while finding more efficient and effective ways to get more things done with what resources they have. SQSS is a tool built to support this business move while helping to build a stronger quality message. It was created anticipating that 4 things would have to change this decade for our healthcare providers as shifting market dynamics related to cost and outcomes would demand a very different management style for quality. First, it would become imperative for healthcare leaders to find much more efficient and effective ways of managing their ever-growing list of quality-related demands without diverting more resources off the front lines. Secondly, these leaders would have to migrate to an ISO-oriented form of quality management with a stronger focus on prevention and long-term control of risks. Thirdly, healthcare's approaches to work would have to start getting more things right the first time in sustainable ways in order to better control their costs associated with fixing the past. And finally, leaders would have to start collecting and producing the real-time big data that more consumer-oriented patients and corporate leaders are starting to ask for. Focused on these business needs, Strategic Quality Support System was built and continues to be refined to provide a cost-effective approach to enterprise quality and risk management in order to expedite closing a 20-year-old gap between where healthcare quality is and where it needs to be for current market dynamics. To do that, it has been specifically designed to support the industry's migration to an ISO-oriented approach for quality management, to make it easier to manage quality real-time, to increase the potential for getting work right the first time, to reduce the hours the workforce dedicates to quality, to decrease the administrative costs associated with quality management, to foster a team-oriented approach that healthcare's hyper-complex environment now needs, to make long-term sustainability achievable, to free up leaders and caregivers from the day-to-day quality monitoring and management demands that take them away from the direct care of patients and activities focused on future growth, to reduce the provider's reliance on costly niche programs that drive tremendous costs into the act of surviving the present, and to simplify building the big data quality reports that are becoming necessary to market oneself as the preferred provider for a more discerning jury of public opinion. The kind of systematization that SQSS offers is becoming increasingly important to the leader who needs to demonstrate greater control over healthcare's increasingly risky environment and can no longer afford to keep growing the small armies of people needed to do it. As the average 100-bed hospital can now have between 10,000 and 20,000 safety-related activities that have to be right the first time, and a similar number of clinical evidence-based standards that determine how strong their definition of quality is, leaders have to adopt more business-smart ways of getting quality-related work right the first time. Rather than dedicating hundreds of man-hours to manually managing and babysitting quality, they can utilize the power of SQSS to coordinate their success. They can use it to manage when activities get done, who does them, and bring in the necessary backups when the primary responsible party is absent. Leaders can free up their managers by using the system to notify the responsible party when an activity is due, notify the right manager when something is not in compliance with the current standards, and issue immediate notices when something does not get done. Thousands of important quality-related activities from across the 20 areas of risk that healthcare is currently trying to manage can be taken care of in one place. At the same time, SQSS is helping the frontline employee take care of his or her contributions for creating a safer patient care environment. It is cueing managers and quality professionals to periodically validate performance to make sure things are happening the way they are supposed to and that quality drift is caught before real damage can be done. Designed to get away from the use of costly niche programs that can eat away at operating margins means that SQSS does not care if the activity is a license renewal, a temperature check, safety equipment check, crash cart check, certification renewal, policy and procedure review, annual TB test, hand washing surveillance, mandatory annual training, competency management, environment of care audit, chart review, monitoring activity for antibiotic stewardship, annual contract review, or the onboarding of a new employee. SQSS can manage it all in one place and pull it all together so leadership's ability to be aware and informed gets a whole lot easier. The goal is to manage as much as possible in one place in a very efficient and effective way, utilizing a safety net model for quality and risk management. By bringing key activities together in ways that reduce duplication, leadership can operate with a better sense of control over an environment that is becoming increasingly risky for financial, operational, and reputational health. It brings all kinds of activities, like those mentioned on the previous slide, together with the management of safety-critical equipment, work orders, and occurrence screens, while making it easier to perform key activities to promote timely analysis, such as root cause analysis, automated trending logs, and at-a-glance run charts. SQSS is constantly working behind the scenes to take whatever information it collects and instantly turn it into usable information. Every time new data is collected, the system automatically updates all applicable dashboards, graphics, and storyboards. The ability to build smaller and more targeted reports that support better decision-making becomes easier as 6 reports where knowing the infection rate is important can simultaneously update as fast as the infection control professional puts the newest number in his or her worksheet. When used to its fullest potential, the long-term sustainability with minimal effort and cost that has always eluded healthcare becomes possible. SQSS is designed for leaders to work with it and their people to get performance where it needs to be and then move on to the next big opportunity for a stronger future while their people and the system work together to hold the line. The system is particularly effective at managing the ever-growing list of hyper-complex quality-related demands that can now easily exceed the human capacity to manage it all manually. Even an activity as overwhelming and task-heavy as hiring one specialty nurse, where a list of over 200 individualized activities can need to be satisfied for successful onboarding, gets a whole lot easier with the power of SQSS. While SQSS is helping the frontline workforce to more efficiently and effectively manage an infinite number of compliance-oriented activities that need to be right the first time, every time, it is also building the massive database that today's healthcare leaders need. In a matter of minutes, a few simple clicks and sorts can reduce thousands of data points into usable information that targets what leaders need to make decisions grounded in fact. Recognizing that different people need different information to be effective in their roles, SQSS is constantly organizing the thousands of pieces of data it collects into a number of specialized reports that support the needs of strategic, operational, and tactical leaders. While it is crunching numbers real time as fast as work is getting done, leaders at all levels can be making more timely decisions with a lot less margin for error. Marrying the power of electronic systematization to the job duties of an entire workforce, the paper and manual activities that have historically competed with people's normal job duties and delayed the creation of actionable information start to disappear. Even dashboards as complex as the one needed to track the nearly 70 measures that tell the health of the revenue cycle are easy in SQSS. While people are doing their work in the system, it is doing all the heavy lifting associated with data organization and report generation so that financial leaders can dedicate their time to decisive and strategic planning on what their next steps should be. The creation of a whole host of targeted and customized dashboards as specialized as balanced scorecards and physician performance profiles are simple in SQSS. Even those big data reports that patients and corporate leaders are starting to ask for become possible in a way that has eluded healthcare. Graphics are the product of quick sorts and a couple of simple clicks. In summary, Strategic Quality Support System is a tool built to expedite closing a 20-year-old gap for an industry that has run out of money and manpower to keep pace with what it means to be a technologically advancing and safety-critical industry. It introduces the power of systematization in a design that is intuitive to how healthcare needs to work in order to get patient care right the first time in business-wise ways. If you would like to better understand the features of the system, please watch the accompanying video titled A Quick Tour of Strategic Quality Support System on the contact page of this website. If you have any questions or would like to schedule a live demo, please contact Nicole using the information listed in this slide. Thank you and have a great day.